Late one night, a woman chased her husband out of the house swinging a golf club. Fleeing in a car, he struck a tree. That's when the authorities got involved. It must have seemed like the public was peering into every private detail of that event. What was happening with Elin Nordgren and her husband, Tiger Woods? As events unfolded, Tiger apologized to his wife and to the world. He had been unfaithful. In fact, his sexual behavior was out of control. The beautiful love story of the quiet, devoted wife and the careful, intellectual sports hero was crumbling before our eyes. Just like us, researchers are curious about what happens to wives when they find out that their husband's sexual behavior is out of control. They are finding that when a person discovers that her husband has been engaging in out-of-control sexual behavior, she can experience something called a relational trauma. A relational trauma that produces a variety of symptoms that can lead to reassessment of self and of reality. So what is a relational trauma? A relational trauma is when one person in a relationship has broken the rules, has broken the code of conduct between the two of them that is implied by that relationship. And it leaves the other feeling betrayed, abandoned, or left without support in a time of need. Steffens and Rennie in 2006 studied wives of sexual addicts and their experience when they discovered their husband's out-of-control sexual behavior. They found that 69.6% of the women in their study met all the criteria for PTSD, that is post-traumatic stress disorder, but one. The one criterion they did not meet was that they did not fear physical harm, although they did experience fear, horror, and helplessness. In fact, 50% of those women experienced functional impairment at the levels of moderate and moderate to severe. Now, let's talk about these symptoms more specifically. Here in our chart, we see an array of symptoms of relational trauma experienced by wives of sex addicts upon discovery of their husband's out-of-control behavior. We can see that these 6 symptoms all feed into this central symptom or process. This information is found in many of the research on wives of sex addicts, but these are specifically taken from Steffens and Rennie's 2006 paper, The Traumatic Nature of Disclosure for Wives of Sex Addicts, with the exception of this one, Rage and Self-Mutilation, which was taken from Dr. S.M. Johnson's 2002 book, Emotionally Focused Couple Therapy with Trauma Survivors. Now, all of these are commonly reported symptoms. Certainly not every wife experiences all of them, but most report experiencing more than one. So let's look at these one at a time. The first one over here is obsessive thoughts, usually about the husband, the event of disclosure, or his other relationships. This one is numbing and loss of functionality. We've spoken a little bit about loss and functionality. Numbing is a feeling of unreality and a lack of natural emotional response to children, parents, siblings, risky events, things like that. This is compulsive checking behaviors, and this is the most reported symptom, and that's things like checking his credit cards, checking his cell phone, calling coworkers to ask questions about what he does at work. This is compulsive. That means it's way beyond what she feels comfortable doing. She nevertheless feels compelled to do it. Here is anxiety and depression, which can also often result in somatic changes like eating behavior changes, sleep changes, and illness. Rage and self-mutilation. With the rage, we can kind of understand self-mutilation can involve things like cutting and burning, things like that. A new view of partner and a new view of the relationship. This relates to the fact that she may feel like she doesn't know the person she's married to, and she doesn't know what the story is of their relationship anymore. She feels it has changed. The compulsive checking behaviors is the most reported. The second most reported is the new view of the partner relationship. And the least reported is rage and self-mutilation. Now, these all feed into this central symptom or process, which is called reassessment of self and reality. Now, this reassessment is painful, but it is necessary for recovery from the relational trauma. In this process, the wife must accept the world as she has found it. She must build new coping mechanisms to deal with new stresses. And she must build personal boundaries, which can be difficult when one's talking about an intimate relationship. Positive outcomes of this process can depend on positive social support, and that comes from Tipsy in 2006 and Zeitzman and Butler in 2005. Recovery happens, however, in the center. And if a wife finds appropriately supportive friends at this difficult time, her story may yet have a happy ending. Now, the story of Elin and of Tiger was not over the night he ran into a tree. It was not over the day he apologized to the world, and it was also not over the day their divorce was final. In fact, we don't know the ultimate outcomes of their story. We don't know if a month later, 6 months, a year later, Elin was experiencing any of these symptoms. But we do know that when a wife discovers her husband's out-of-control sexual behavior, it changes things for her. The relationship that was once a nurturing environment has become a source of danger and of pain. This is a relational trauma. It is experienced by many women like Elin, and it manifests symptoms that cause her to re-examine herself and the world. The good news is that there can be healing on the other side of relational trauma, especially if we who are nearby support the wounded wives we know. Okay, thank you, and it's time for some questions, if we have any questions.
Isn't this a little extreme?
Yes. Although these may seem a little extreme, we have to remember that psychological labels are labeled on the most extreme end of a range of behaviors. Certainly not every woman who experiences rage will chase her husband with a golf club.
What good does knowing this do?
Yes. Knowing this can help us in 3 ways. The first way is that a husband can understand what is happening to his wife when she finds out. Another way is that friends around her can have some idea of what is going on with her and not think that her responses are unnatural or a sign of mental illness. And the third thing is that she herself can have some perspective on what is going on, knowing this, and that she can know that there is hope on the other side.